The World Health Organization wants to control the food you eat, where you travel, and even your medical decisions. Welcome to Freedom Alive. The Biden administration is setting the stage to hand ultimate control of America's healthcare system and U.S. national sovereignty over to the World Health Organization. That is, unless Americans push back and Congress passes legislation declaring that America will not be subject to these world domination plans. Amber Haskew, Director of Public Policy for Liberty Counsel and Liberty Counsel Action, joins us to unpack this tyrannical attempt against Americans. I'm blessed to again be joined by our co-host, Matt Staver from Liberty Counsel. And Matt, I've read in Liberty Counsel's communications that one of the World Health Organization's plan is for Americans to eat bugs.
Yeah, as crazy as it sounds, but there's this intense pressure globally, and it is not only the World Health Organization, but it's other people like Bill Gates, and it centers around climate change and consequently the elimination of beef and other kinds of meat products to replace them with fake meat, which includes, and I'm not joking, bugs that actually the World Health Organization says can be very nutritious and so forth. You know, it sounds absurd, and you think, well, you can just blow that off. It's not going to happen. But the problem is, in May of 2024 is the World Health Assembly meeting, and the Biden administration literally plans to sign on America to the WHO so that its directives would no longer be advisory, but legally binding on the United States of America and the other 194 nations.
For those at home, we've been tracking this issue with the World Health Organization over the last several years on Freedom Alive with some fantastic guests. There is much to unpack today, but our Freedom Alert is next.
Ohio legislature overrides governor to protect children. The Ohio Senate joined the House to override Governor Mike DeWine's veto of a bill that allows the state to protect gender-confused children from medical mutilation. It also protects females from competing against males in interscholastic sports. The bill is known as the Saving Ohio Adolescents from Experimentation, or SAFE Act. It specifically bans physicians from administering puberty blockers, hormone treatments, and mutilating surgeries on children under 18. The bill also protects female sports by barring biological male athletes from competing on female sports teams in schools and in public and private colleges. These lawmakers are doing what all legislators should do, and that is to enact wide-ranging protections for children from the harmful gender ideology agenda. All states need to take a stand against this billion-dollar industry.
Up next, Matt's interview with Amber Haskew.
I'm very pleased to welcome our special guest and a longtime friend and colleague, Amber Haskew. She is the Director of Public Policy for Liberty Counsel and Liberty Counsel Action. And among many other things, she has become an expert on the World Health Organization. Welcome to Freedom Alive, Amber.
Thank you so much. It's great to be here. Thank you for having me.
I want to set up what is going on with the World Health Organization. The World Health Organization, of course, is an agency of the United Nations. And right now, kind of like the Center for Disease Control, if you will, it gives different kinds of directives or statements that we can either take or leave. They're advisory. But what's coming down the pipe is a change, or a change that could happen unless people wake up and stop what's happening with the Biden administration. And that would mean the WHO would move from an advisory organization to an organization when it speaks would be legally binding on the United States of America and all of the 194 member nations around the world. Take us why that is possible and kind of explain, set the groundwork for this.
So first of all, what's happening is there are two separate tracks, there are two separate paths that the WHO is working on right now. One is considered a pandemic treaty or an agreement. and then the other is considered an update to existing amendments. And I think this was intentionally done so that it kind of splits the power that it's asking for between these two separate documents. But when you actually look at both of them and combine both of them together, the power that it is asking, really demanding for, is off the charts. We're talking not just what you had mentioned, the legally binding, but the scope of what they plan to have control over is just breathtaking.
And it really is a one world government. You know, we talk
Absolutely.
about one world government. How could that possibly happen? But this is the way that it can possibly happen. And it is closer than when most people think, because the next meeting for the World Health Organization is coming up in May of 2024 at the World Health Assembly in Geneva. And that's when the Biden administration plans to sign America on to this World Health Organization agreement, including right now at least 300 plus amendments to what's called the International Health Regulations. The question that most people are going to ask is, how can a president just unilaterally sign America on? Does not this have to go through the United States Senate for 2/3 majority vote if it's a treaty?
And that's one of the things that a lot of people don't understand. We aren't always paying attention to everything that happens in DC, and that's why we want to talk to you and kind of wake you up to the realities that are happening right now. If you look back to the Paris Accord, it was billed, it was described as an accord, and then once it was in place, once we are already involved in it, then it suddenly becomes what they are calling a treaty, and it becomes that legally binding document. And so there is a history of our leadership kind of billing something as one thing, and then after it's in place, after we're already involved in it, then suddenly it's a treaty and we have to follow it. And so there is a long history of our government just kind of slipping these things under, and then us being bound to following what is agreed upon.
So let's set the record here so that everyone really understands how this can happen. First of all, if it is a treaty, you do need 2/3 vote of the Senate. That is under the United States Constitution. But the Paris Accord, or the Paris Agreement, that was unilaterally signed onto by Barack Obama, was an amendment to a previous treaty that had been ratified by the Senate. That goes back into the 1990s, and it was a climate change agreement treaty that was ratified by 2/3 vote in the United States Senate. So what Obama did was unilaterally sign on to additional requirements, legally binding, and he did it on the basis that there was already a previous treaty in place, so it didn't need to go through the United States Senate. Let's look at a screen here, and let's just walk through some of these bullet points. So in 1948, the World Health Organization Constitution comes into effect. And at the time, there was a treaty that was taking place, and there was 2/3 majority vote of the United States Senate for the World Health Organization Treaty. And for the first decade or so, a couple of decades, the World Health Organization just focused on diseases such as tuberculosis, malaria, yaws, syphilis, smallpox, and leprosy. Then, in those early years, they developed the International Classification of Disease, which is the ICD codes. And anyone who works in medicine or medical knows what the ICD codes are. Those are universal codes that came from the WHO. In 1969, then, after the treaty was signed, the WHO passed these international health regulations. They were very minimal. Then in 2005, the President George W. Bush, in his second term, signed America on unilaterally to the revised international health regulations that were much more extensive, still advisory, not legally binding, but they were much more extensive than the original treaty in the IHR. And then that means that did not go through the United States Senate. So he did that just like Barack Obama did to the climate change agreement, unilaterally signing America on to some new criteria and requirements, arguing that the treaty had originally been already passed, and consequently, he could unilaterally sign it on. So George W. Bush did it, Barack Obama did it, and now in 2024, it looks like Joe Biden wants to do the same thing. So that's the background. That's how it can happen unilaterally. And Amber, I'd like to just pause for a moment. Now that we've covered that, what does this new international agreement actually do? Whether it's a pandemic treaty, whether it's the international health regulations, whatever you call it, when he signs on, give us some bullet points as to what this will actually do and how it will affect everyone who's watching and everyone in the world.
Absolutely. One of the first things is that this is planning, it's very clear in the text, to launch socialized medicine, socialized healthcare for an extra 1 billion people across the world. And, everybody supports the idea of people getting the care that they want, but we know that socialized medicine is a disastrous way to attempt that. And so, again, getting back to these two tracks, one of them says, we're going to provide all of this medicine, but they don't say how. The other track says it's the rich countries that are going to pay for this. So they are going to be looking to nations like America to provide this incredible breadth of medical care across the world. And this is one of the things, as we've been tracking the WHO over the last 3 years, we've seen, like last year, they attempted a smaller effort of this, and the smaller nations were not interested because there wasn't any carrot, there wasn't any benefit to them to signing on. And this time around, I think it is much more dangerous, much more pernicious, because they're offering basically a blank check from the American taxpayers to pay for medical care in every country across the world. And we're sitting in a situation where our current veterans aren't getting the care that they need. And yet we're looking at just this blank check absolutely bankrupting our nation. And so that's just one of the tenets. We're also looking, they've already launched a vaccine passport. Was active in 80 countries. And so we're right at that halfway tipping point. They have the technology. It's already set up. It's already operational. It's already in the EU, the European Union, the African Union, Australia. These are big countries that have already signed on to this vaccine passport. And then the other thing is the WHO is looking at controlling every aspect of medicine. And so the medicines that are available, the medicines that are not available, the testing that's available, the testing that's required, and all of this is already can be just uploaded to a technology system that's currently in place. So those are just a start of some of the things that we are looking at and that we are seeing in these documents.
So the main thing, though, is that whatever the WHO says now, the WHO, it's advisory. You can take it or leave it. You can say, well, that's just the WHO. I don't really care what they say. We'll go out and do whatever we want to do. But with this signature by Joe Biden, that will make the WHO directives legally binding. So whatever the WHO says now, then the United States of America will have to follow. It will be mandatory and it will be enforceable under an international court. So all of the litigation, for example, on some of the shot mandates, the lockdowns, other kinds of restrictions that came out of the Biden administration that were challenged in court, and we were successful in court against those mandates. None of those would be challengeable in American courts anymore because those directives would be coming from an international body that the United States courts would not have jurisdiction over, and it would go to the World Court in Geneva or at The Hague, and that's where we'd have to litigate before a foreign body of individuals, most of whom that sit on that bench are not legally trained anyway. So it changes from advisory to legally binding. And here's the critical language as well. It expands the scope of the international health regulations to include scenarios that merely have a, quote, potential to impact public health. Anything that has a potential to impact public health then comes under the jurisdiction of the WHO. And whatever it says is then legally binding on the nations. And so talk about how broad that term public health is within the WHO. It's not just medicines, but it will certainly control medicines and vaccines, but it controls many other things as well. Public health is quite extensively broad in the WHO's definition.
Well, with this, first of all, the thing that is so critical to understand is that there is one person that can declare a worldwide health organization, and that's Tedros Adhanom Ghebreyesus. And he is the one that wholly and fully alone holds the power to make that determination. And the thing is that it can be something that is only limited by his creativity as to what challenges this. It can be global warming. It can be the temperature in the ice. It can be the temperature of the ocean. It can be smog in the air. It can be, how many cows there are in a certain nation, or the list just goes on, how much salt is being consumed. Anything that has the potential, what kind of vehicles people are driving. This list just goes on and on and on to be able to control how much freedom you have, where you can be, where you can work, what you can do, where you can live. All of these things impact in one way or another public health. And so that gives him a blank check to at any time determine that he's going to call something an emergency. And at that declaration, his powers are unlimited.
So public health in the WHO, the definition of public health is not just the absence of disease. So it is a very comprehensive definition of public health or health. And in fact, if you go back to the abortion decision, Doe versus Bolton in 1973, the companion of Roe versus Wade, the Doe decision used the definition of health from the WHO at that time back in the 1970s. It's even more expansive now than it was then. So it includes psychological, physical, emotional, financial, age, sociological, all kinds of things, more than just the absence of disease. So within the WHO's scenario, it becomes empowered to act when there's any potential to impact public health. Not when there's a public health crisis, when there's a potential to impact public health. And public health includes things such as abortion, access to abortion. The WHO has already said that after the Dobbs decision overruled Roe versus Wade, that created a public health emergency or crisis because people needed to have abortion. And you have states that restrict access to abortion or limits on abortion. Under the WHO, that's a public health crisis, and they would have the power to give a binding directive on the United States of America. So abortion, LGBTQ, puberty blockers, cross-sex hormones, mutilating surgeries, even on minors, parental consent for abortion. You have climate change, whether you drive an electric vehicle or not, whether you can have exports or imports, whether you can consume so much gas per month or whether you're going to be limited. All of these things and much more. Gun control, violence, all of these things come under the rubric of public health. Frankly, there's nothing that can escape public health. There's a number of other areas. You talked about vaccine passports. There's a lot of movement on that. Tell us about what's happening already. And this is also, I understand, part of the WHO's agenda.
So what we're looking at with vaccine passports is the technology is what concerns me. Once they have the technology in place, they can add any requirement, any data, any statistic, any information about the individual that they want. And this is already launched. It's already operational. It's already been tested in the EU. And the head of the WHO was boasting, Tedros was talking about how successful it was. And one of the things I love about Dr. Naomi Wolf's background, she's a PhD. She's the CEO of a technology company. And she says, you don't understand how much can be added once this technology is in place. And when you take that and you pair it with the fact that the WHO, through these documents, is demanding that nations track the race, the gender, the age, the religion of each of the people that they're treating, their vaccine status, their test results, all of this stuff is already something that the WHO is planning on tracking in the current documents that are coming before the World Health Assembly in May. And just to kind of show you, give you an example how detailed this is, it's not just tracking you. If you look at one area of shipping, they want to know what's being shipped. They want to know how it's being shipped. They want the manifest for everything that's on the shipping container. They want how it's being treated during the shipping procedure. They want total control to be able to control and shut off any borders that they want to shut off any things that they want to specifically. So if somebody says, oh, a Bible is unhelpful, they can close the border to all Bibles. And so this just gives you a tiny example of how the breadth and the depth of the control that they want.
Well, to give an example, one of the items, and like there's 307 amendments, and they're trying to hide the ball as to what they finally will look like. We've gotten an understanding of what they look like, but they keep changing. So this is a massive deceptive process, but it is a massive change. One of the items that is in their documents, if this becomes signed by Joe Biden, is the United States of America and all the other member nations will be required to build facilities at every port of entry and maintain them. So at each port of entry, take, for example, the United States, whether it's California or the other East Coast or any place where there's ports of entry, we will be required to build facilities for the WHO that'll have the WHO symbol on the outside, and the WHO will monitor imports and exports, and they will mandate as to what can come into the country, what must not come in, what must be exported, or what can be exported. And they'll also control what kind of medicine. So, for example, if the United States is creating a medicine to address a particular disease, they can require different private entities in the United States to manufacture and not use that in the United States, but use it some other place based upon their notion of, quote, equity. And it may then go to some other various countries that are poorer countries, even though we may need it here in the U.S., the WHO will have total control to mandate where it goes. So it's an unbelievable power grab.
Right. And everything that we've described up to this point is really just a start. When I was doing research, I was able to kind of go inside of their own websites and find additional documents that they were not publishing. And it was very clear in multiple locations that they considered everything that we have just described only the start. And they refer to it as, quote, a living document, to where these things are just kind of an idea launching pad. They're not limiting themselves to anything that we've just described here, but this is just what they could think of right now. And as other needs for control or tyranny or dictatorship come up, that they have every plan to take advantage of that.
As strange as it sounds, as bizarre as it comes across, I mean, the WHO will be able to control where you work, where you shop, where you dine, where you assemble publicly. Take us back, for example, when we just think of some of the absurdities during the COVID lockdowns where you couldn't work. Some people were considered non-essential in their jobs, so you had to stay home. You couldn't go out on the roads. You had to wear masks. You had to do social distancing, which was all a ruse. You couldn't assemble in churches, even though you could assemble in large quantities in big box stores. All those kinds of mandates would be under the power of the WHO. So if you had a church, for example, that said, well, we're going to worship anyway, as we had some during COVID, and they realized it was unconstitutional and wrong what the governments were doing, the WHO, with this vaccine passport that not only tracks and traces you, so they know everybody who's in your same vicinity, not only has your location, not only has your medical information, but can also have your financial information as well, and consequently literally shut you down with the click of a button and enforce what otherwise we were able to challenge as unconstitutional in the courts, enforce it on people. And when we were trying to challenge it under that scenario with the WHO in charge, we wouldn't be able to because it would be in a World Health Organization world court.
That's absolutely correct. And I think we are so used to having our constitutional rights that we think, oh, something of this breadth, we'll just challenge it in American courts and we'll make it go away. That's what we did under COVID. And, we had just these outrageous situations where individuals could be together for one thing, but then the moment you started talking about God, it was, outlawed under COVID. And so we've seen firsthand this incredible tyranny just spring up out of nowhere in our nation. But we did have those constitutional protections here. And we would not have the ability or the strength to bring them to an international court because it would just be a voluntary agreement between two nations.
Well, you can go to lcaction.org /WHO, lcaction.org /WHO, and there you'll find information about HR 79 to defund the WHO. Make your voice heard, send faxes, sign the petition. We're making progress, but we need your help as well. lcaction.org /WHO. Make your voice heard now. Time is of the essence. May of 2024 is when this critical meeting is taking place. Thank you, Amber, for joining us, and thank you for watching on Freedom Alive.
Thank you so much for having me, Matt. It's been a pleasure.
Matt, this World Health Organization that we've tried so hard to cover over the last several years has unbelievable scope, frightening, unlimited scope, really with legitimate one world government implications, and all done with almost no information coming from our government during this entire time. It's really almost impossible to talk about this story, though, without mentioning Bill Gates and his role and involvement.
Yeah, Bill Gates is a eugenist. He is in the line of Charles Darwin. He wants to raise a super race. He is a population control individual, and he wants to limit the number of people on the planet because he thinks that in doing so, you can reduce carbon emissions and therefore save the planet. And so he has a 4-part plan, and that's through abortion and also through vaccines that would limit the number of people.
For those of you at home, we just urge you to be involved, to be engaged with your elected officials. This is a staggering, game-changing initiative for our nation and really for us as citizens. We would never have known anything like this in our lifetime or the history of our country if this would be enacted. Well, in closing, remember Proverbs 2, verse 12 and 13, which says, "Wisdom will save you from the ways of wicked men, from men whose words are perverse, who have left the straight paths to walk in dark ways." Our freedom is a gift from our Creator. We must never forget that and always protect it. So join us here next time where you'll hear victories as well as ways you can stand up for your priceless freedom. Join us again for Freedom Alive.